Assalamualaikum warahmatullahi wabarakatuh. We are from Past Perfect Tense Group, and today we will talk about mental health. But first, we would like to introduce our member. My name is Jamil Zuldani from semester 3A class, and my friends.
My name is Mayang Qoriah from class 3B, and my name is Anisa dan Herdia. I'm from class 3A.
My name is Shavira. I'm from semester 3 class A.
My name is Ega Wati. I'm from semester 3 class B. My name is Nadira Fahirsya from semester 3 class A. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood.
Although mental health is currently saying, but what of them is not saying. What is poor mental health and mental illness are really not the same. A person can experience full mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience the method of the physical, mental, and the social.
Why is mental health important for overall health? Mental and physical health are equally important components of overall health. For example, depression increases the risk of many types of physical health problems, particularly long-lasting conditions like diabetes, heart disease, and stroke. Similarly, the presence of chronic conditions can increase the risk of mental illness.
Can your how mental health change over time? Yes, it's important to remember that a person's mental health can change over time, depending on many factors. When the demands placed on a person's time, their resources and coping abilities, their mental health can be impacted. For example, if someone is working long hours, caring for a relative, or experiencing economic hardship, they may experience poor mental health.
How common are mental health? Mental illness are among the most common health conditions in the United States. The first one is more than 50% will be diagnosed with a mental illness or disorder at some point in their lifetime. And 1 in 5 Americans will experience a mental illness in a given year. And 1 in 5 children, either currently or at some point during their life, have had a seriously debilitating mental illness. 1 in 25 Americans live with a serious mental illness, such as schizophrenia, bipolar disorder, and major depression.
And what causes mental health? What causes mental health? There is no single cause for mental illness. A number of factors can contribute to risk for mental illness, such as early adverse life experience, such as trauma, or a history of abuse, for example, child abuse, sexual assault, witnessing violence, and others. And then experience related to other ongoing medical conditions such as cancer or diabetes, biologic factor or chemical imbalance in the brain, use of alcohol or drugs, and then having feeling of loneliness or isolation.
Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Wini Aria from class 3A. Conclusion about mental health. Number 1, mental health is a condition that a person has no trouble or mental illness in which he or she is endowed with self-adjustment and environment and is able to develop harmonious and balanced potential. Unstable mental health or mental health disorders can affect the patient's physical health and spirituality, with the patient's physical health hampered and the patient's spiritual health impaired. Chemotherapy patients with unstable mental health or mental health disorder have a spiritual need that can be met by using a mental and religious support or psychologist. The patient's spiritual need with the guidance or prayer. Prayer consists of a numerous dimensions of meaning, of hope, of connection with the Lord through worship, forgiveness, and transcendence. Number 2, Islamic spiritual guidance provide an alternative to meeting spiritual needs and helping to cope with mental health in chemotherapy patients. Chemotherapy patient mental health is generally triggered by a lack of a substance resulting in anxiety, fear of sleeplessness, and a breakdown in the mental health of both physical and psychological patients, as well as misunderstanding to draw close to God when sick and about ordinance of worship for the sick. Patients are in an unstable state of mental health. Patients fail to find meaning in their life. Therefore, the spiritual guidance of Islamic worship is administered to chemotherapy patients with guidance from prayer, to the performing guidance for worship, guidance give material, therapy, and invite patients to examine and practice prayer by guiding them. It is effective because it sees the result of patient action that are more positive after each one is given a mentor. Thank you.
Maybe that's it for all of us. I apologize if you have a mistake. If you have any questions, please comment down below.
Don't forget to like, follow, comment, share, and subscribe. Wassalamualaikum warahmatullahi